When patients who undergo surgery leave the hospital, they are often prescribed powerful medication to help with the pain. Now, researchers in Ontario say far too many of them are getting hooked on the drugs. Doctors found about 3% of the patients were still taking the meds 3 months after surgery. That sounds like a small number until you consider how many surgeries are performed each year. Global National's Jennifer Tryon has been looking into this for us. Jen?
Robin, imagine going to the hospital for an operation and getting hooked on the medication doctors send you home with. Well, that's what's happening to nearly 1 in 33 patients every year. Ontario researchers studied nearly 40,000 patients after surgery and found nearly half were going home with prescriptions for painkillers like oxycodone or morphine. Now, what's more is 3% were found to be still taking these prescriptions more than 90 days after the surgery, suggesting the addictive powers of opioids are just too strong for many patients.
It clearly signals that there's a problem and that we need to have good information to address the problem. And again, 3.1% is not a small problem when we look at the over 200 million surgeries that occur worldwide every year.
Ontario has one of the highest rates of prescription opioid use, and these drugs are still considered to be amongst the most effective for severe pain. However, this study showed that young people and those with lower incomes were more likely to go on continuing using the prescription, making them at very high risk.
The other risk factors for sure are things such as your psychological comorbidities. You know, we found that younger age was associated with a higher instance of continuing opioids, as well as those from a lower socioeconomic background.
These researchers are suggesting doctors start assessing whether patients are in this high-risk group before prescribing opioids after surgery, or at the very least, following them afterwards much more closely.